Hello and welcome to another edition of India Today's Digital Bulletin, where we focus on Omicron. I'm Milan Sharma. First, let's look at the latest situation in terms of cases, and it's not good. India is recording about 2,630 Omicron cases that have been detected. Maharashtra has the largest number of Omicron infections. Delhi comes in a close second. States like Kerala, Gujarat, Tamil Nadu as well are recording high number of Omicron infections. About 995 people have also recovered after being infected. The number of cases in India have also soared. More than 90,000 cases have been recorded in a single day. We may as well cross this mark of 1 lakh by another day as cases continue to surge with a positivity rate of 6.43%. Well, in all this, the Tata Medical and Diagnostics Limited have created a kit that will help us understand and detect the Omicron virus faster than genome sequencing. The test kit has been named OmiSure and will be available in laboratories to check for this particular infection through this variant that has been the cause of surge across the entire country. Let's see this report.
If you catch COVID, chances are you will not get to know which variant infected you. This is because genome sequencing is conducted on only 5% COVID positive samples. To ease the trouble and reduce the burden on genome sequencing, the Indian Council of Medical Research has validated a new kit, OmiSure. It's a COVID test kit made by Tata Medical and Diagnostics Limited. This RT-PCR kit amplifies RNA in a virus to detect the genetic material. When the test detects the presence of other genes of the SARS-CoV-2 virus but fails to detect the S gene, it is considered indicative of Omicron infection. S gene dropout is a trait associated with Omicron.
It's very difficult to comment a patient who is COVID positive, whether it's an Omicron or something else, because we don't have that kit. It is something known as S gene target failure detecting kit. That is being imported by the government, and very soon it will be available as a dual PCR. At the first PCR, you detect it's a COVID. The second PCR, you detect that we are not able to detect S gene. So likely this may be Omicron. So need not to send a sample for gene testing and for the particular strain. So this is an indirect way to detect this is a Omicron or is it Delta or something else.
The ICMR has also created another COVID test kit, but it has failed to find interest among manufacturers. The only kit approved by the World Health Organization is TaqPath RT-PCR kit, made by US-based Thermo Fisher Scientific.
Fortunately, we did not have an Indian RT-PCR kit till now that could detect the Omicron variant. We had to depend on the imported TaqPath kit, which was made by Thermo Fisher of the United States of America. But ICMR, in association with Tata Medical Diagnostics, has now made the OmiSure kit, which is made in India, and it will be able to detect the BA1 variant of Omicron by the SGTF or the S gene targeted failure technology.
The Alpha or B117 variant 2 sees S gene dropout, but its circulation is low in India. When S gene is not detected in the virus, it is considered to be Omicron. But genomic sequencing may still not lose its relevance. The S gene dropout is not being detected in a variant of the Omicron lineage, BA2, which has seen further mutations.
Why is it important to know which variant you're infected with so that you can move forward to an appropriate line of treatment? If it's Omicron, then monoclonal antibodies don't work on such people. And also after 5 days, you will turn asymptomatic. But if it's Delta, then it can cause COVID-induced pneumonia in the lungs and you can need oxygen. Only an S-gene failure target test will help determine which variant it is. With Pawan Kumar in New Delhi, Milan Sharma for India Today. Well, in an exclusive interview with me, the head of R&D, Dr. Ravi, spoke about what the possibilities are for this kit being accessible to people in India, as well as at what price will it be available for people who wish to find out which variant they have tested positive by? Listen in. Is this test kit going to be available for the common public, and how does it work? How can you and I test with it to find out if we are infected with the Omicron variant?
Thank you, Milan, for having me on the show. The OmiSure kit is a real-time PCR kit. It is designed to be used on all available real-time PCR machines. It detects genetic material in the nasopharyngeal and throat swabs of individuals where the specimen is collected. The principle of the test is it specifically identifies Omicron. How it does is using two strategies combined into one. The first strategy is it picks up S gene dropout, meaning because of mutations in Omicron, the conventional PCR will not work for S gene. Now, there are some kits in the market which do that. This is called S gene dropout. In addition, we have made sure that we have S gene specific mutation detection. For the first time in the world, these two have been combined along with another gene called RDRP of the virus. Together, what these three genes do is they identify all SARS-CoV-2 viruses, all variants. If it is Omicron, then the gene dropout will be detected, plus the gene mutation will be detected. Therefore, in a matter of 2.5 hours, by routine real-time PCR, we'll be able to say if it is Omicron or not. The biggest advantage this test has is it has been confirmed on sequenced samples by ICMR in their extensive evaluation. So we hope it is going to replace genome sequencing. The third thing I would like to mention is it is a PCR, so it cannot be done at home as a self-test because it is not an antigen test. So the specimen has to be collected and the test has to be carried out in the laboratory.
Even at the Make in India OmiSure kit will help us find out whether we're infected with Omicron. But I spoke to Dr. Christopher Murray earlier, who's the director of the Institute of Health Metrics and Evaluation. He paints a grim picture for the case projections. According to modeling studies, India may see as many cases as it saw in the second wave of the Delta variant, or even more. He has more details on what will be the case peaks for India. Listen in.
You have given some predictions and the modeling studies based on which you say that there could be at least 3 billion infections in the next 2 months. That seems to be a big number, but what are your current projections for India that's already looking at a slow emergence of the third wave of coronavirus led by Omicron?
Well, because India had such a terrible Delta wave, that combined with vaccination efforts suggests that there's quite a bit of immunity in India that will provide some protection against Omicron. So what we expect to happen is lots and lots of Omicron infections, reaching a peak in the end of January or first week of February. The number of infections per day may get up as large as the Delta wave back in April and early May. But the big difference is that the Omicron is not going to cause the death and hospitalization that we saw before. And so the other thing about Omicron that's very different is a much larger fraction of people have no symptoms at all. So they may never get detected. So the official case data may not increase in India anywhere near what we saw with the Delta wave.
So, Doctor, essentially what you're saying is we could probably see the similar number of cases we saw in the second wave. India peaked at about 4 lakh cases during the Delta wave, but these were very severe infections as well. And you're saying that Omicron is not going to cause increase in hospitalizations and death, despite the fact that case numbers will be large?
Well, I think it's very important for people to recognize the difference between infection and an official case. With Delta, many of the infections got eventually detected and became a case in the official numbers. But with Omicron, with 90% of people having no symptoms at all, most of those people will never become an official case. And so there's going to be this very big distinction between true infections in the community and the number of cases that you pick up. And then even amongst the cases that get diagnosed, that get tested and get recorded, we know with Omicron that a smaller fraction will go to hospital than for Delta. And amongst those that go to hospital, a smaller fraction will end up needing the ICU or intubation.
Now let's take a look at the Omicron situation in the world, where in the US specifically, hospitalizations are rising fast and are rising very, very quickly. We are looking at a record hospitalization of children. About 672 children per day were admitted to hospitals with COVID-19 in the United States in the week ending Sunday, with about 114% from the previous week rise that was recorded according to the US CDC. As cases across all age groups are soaring and spreading, infections are being led by the Omicron variant there. The rise in hospitalization has come after the American Academy of Pediatricians recorded over 325,000 new COVID surges in children during the week ending in December. This is a 64% increase from the previous week and the largest number. Omicron has been responsible for more than 95% of the infections in the country, which is very worrying according to the US CDC. Well, that's all we have for you in this edition of India Today's Digital Bulletin on Omicron, leaving you with this hope as you stay safe, mask up and maintain social distancing, follow COVID-appropriate behavior. Thank you for watching.